again American healthcare entrepreneur Rick Scott.
Rick, briefly put, how would you sum up your thoughts on the healthcare systems in Canada and Great Britain?
What we saw in Canada is very similar to what we saw in Great Britain. Both government-run systems have, by trying to control cost, have done it to the detriment of patients. They both have had to ration care because they run out of money. And as we've learned on both these trips, we met strong advocates to try to add competition and choice in to fix their systems and take care of patients.
Rick, waiting lists seemed such an essential part of both systems.
We saw waiting lists in both countries, and they're significant. And you can't imagine how that's any good for how that's good for a patient, and you can't imagine how the impact of that on the physician-patient relationship.
Lots of heartbreaking stories we heard in Great Britain.
It is horrible to hear about the expensive drugs that the patients don't get because the national board decides that it's too expensive. Now what we learned is they're trying to, now they're starting to allow individuals to pay their own way for a drug that a national board wouldn't approve. And now what you worry about is the people that can't afford it.
And this notion of assigning a monetary value to a person's life.
Who wants to make life and death decisions based on some artificial value of what a life is worth and having some national board do that? I can't imagine doing that in America.
Rick, after the time you spent traveling and talking with people in Canada and Great Britain, what's the thought that stands out in your mind?
What's been driven home from these trips is, as appealing as a single-payer system appears, people have to look at the impact of that and the impact on patients. And I think the individuals that are focused on single-payer systems are doing it with blinders on. What they ought to do is they ought to travel to these countries, and they ought to really talk to the individuals that are impacted by, especially the individuals that are adversely impacted by the policies, especially the national health boards, things like that.